Thank you, Dr. Moore. Good morning. I'm Kamal Jethwani, and thank you to the Institute of Psychiatry and Dr. Baker for inviting me to speak here today. I'm going to take a slightly different tack. So I think Dr. Moore set it up really well and talked about two key things that I think are worth focusing on. One of them being that we may or may not be designing our applications for our patients in mind the way they want to see it. And then the other thing is we may or may not be designing our applications for our health systems in mind. I work at Partners Healthcare, and so I'm going to be taking a little bit of a healthcare system approach to what I'm going to talk about today. So I have a really interesting role at Partners. I'm the Senior Director for Connected Health Innovation, which means that I look at how to create and validate technologies based on the needs that are being felt in our delivery network. And then how do I validate these technologies so that I can tell a physician, look him in the eye and say, yes, this works, trust me. And then also figure out a way to get it implemented and scaled within the organization, right? So what we're trying to do is go away from this phase of constantly doing 50-60% pilots. And so for that reason, the team that I have set up at Partners Healthcare works really, really closely on the first very phase of when we start working on a project, which is how do we design something that actually works? Because if you do that well, you can take it all the way to the end and it'll continue to be successful. Technology has revolutionized a lot of industries. I had an interesting conversation with an interview with one of my research coordinators that we were hiring. She was 21 years old, and somehow we got into banking. And when I got to bank tellers for some reason, I don't know why I said that, she looked at me and she's like, "What's a bank teller?" And I'm like, okay, that's interesting. She's like, "Why would you go to a human being for money? Like, couldn't you just go to the ATM?" I'm like, well, before the technology got there, we actually had to do that. And that's really, it's an interesting reminder to us about how much technology has changed our life around us. But we still receive healthcare the way we did in the 1950s, 60s, 70s, you name it, right? But I think the time has come. And the evidence for that is in how much money is being invested in digital health. So this is a graph that shows investments in digital health from 2014. And every single year, investments in digital health have gone up. So much so that in 2017, the investment was higher in the middle of the year than it was ever in the previous years at the end of the year. What's more interesting than that is that the size of these deals has been increasing every year. So this graph actually shows you, the circles at the bottom show you the average amount of investment per company. Why is this important? The reason this is important is, as an investor, they might put a little bit of money in an idea that they think might work, right? But as these ideas get more and more mature, and as their confidence in the industry starts to get better, they're starting to invest more money to make sure that these ideas actually become successful. So deal size has been increasing every single year, and I have data only till the middle of 2017, and at that point it was about $18 million per deal. What's also really interesting is that over the years, there has been a movement in funding, and now the kinds of applications that are being funded are more health system-centric ideas. So if an entrepreneur goes to an investor and tells them that I have an idea that's actually going to fit into the healthcare system, they're more likely to get funding now than they were a couple years ago. And this trend is not just overall digital health, but the trend is being replicated in mental health as well. So in mental health, again, I have data from 2012. As you see, each and every year, the amount of money being invested in mental health has been going up pretty significantly. There's a little bit of an aberration at the end because data from 2017 is not completely available. But what this is telling us is that there are a lot of really cool, neat ideas and products out there available today to be used. And as Partners Healthcare, as a conglomerate of about 13 hospitals, we're asking ourselves, okay, how are we harnessing this? How can we bring this in? How can we use this to disrupt healthcare? And how can we do it before that kid in a basement at MIT is going to do something that's going to put us all out of business, right? So I'm going to talk about it in three specific ways. And the first one is access. how can we improve access, or what are ways in which we can improve access to care for our patients? And for digital health, we think about it in this 2x2 diagram. This is basically dividing up synchronous and asynchronous kind of interactions, and then the other axis is provider to patient versus provider to provider. So basically, whether it's a visit or it's a consult. And so if you sort of look at this 2x2, there's technologies available in each of these buckets that are now being tried out at Partners Healthcare across different things. Virtual visits, which are synchronous patient to provider interactions, those are happening through video right now, mostly. And we have about 5,000 visits that happen through synchronous visits in psychiatry at MGH. E-visits, which is sort of store and forward, which is the patient sort of thinking about what they need and sending it as a message, either as an in-basket message in Epic or through our actual e-visit platform. And then this is sort of what we usually ask providers to do is, respond within 72 hours. That's also building up, and we're also figuring out ways to get paid for that. And on the other thing, on the consult side, we also do virtual consults, mostly now in neurology, and then e-consults are being picked up as well. And what's also really interesting is within e-consults, our biggest line of business at Partners is second opinions, and about 50% of that business comes from international sites. So patients from outside of the United States sending us second opinions to be looked at by providers within the Partners network. The other way, so now getting to sort of, the patient self-service aspect of it, right? Talkspace is an app that you can download, and if you are having trouble finding an appointment with a therapist, they will get you one. You go in, you fill a form, within 24 hours you're assigned a therapist of your choice, and then you can basically chat with them every day. They'll respond to you about twice a day, and they will also throw in a video visit once a week. This platform right now has 300,000 users, out of which 120,000 users are active at least once a week, which is pretty significant across the United States. There's a number of other apps that are also now using AI. So, you may not have a human being behind it, but for a lot of the administrative work, there is intelligence built in to be able to respond to you and augmented by a human interface. And then there's also platforms that are now leveraging peer-to-peer support in doing the same thing. So you may not have a therapist on the other side, but you may have peers that have gone through the same experience, sometimes multiple peers in a community responding to you and chatting with you and providing support. And it's really interesting because all of these platforms are growing fairly significantly very quickly. Another interesting angle that is being taken by provider systems now is the employee assistance program. So this is an example of the Big White Wall. It's a company that was formed in the United Kingdom, and their focus is completely on providing employees mental health support. So what they have is they have walls, which are basically like your Facebook page, for example. You can post things, people respond to you, et cetera. But they have intelligence built in where they use trigger words to figure out if a person is really in need. So if there's any impending harm, if there's any evidence of self-harm, et cetera, those trigger words then alert a wall guide, and then the wall guide sort of looks at it, triages them, sends them to the employee assistance program, et cetera. This program in the United Kingdom has shown fairly significant value in being able to identify early and intervene early in employees who need immediate care. The second category is around patient self-management. And so Dr. Moore talked about self-help, and we're taking it a little bit further. So how do you really think about taking some of these self-help tools, but actually integrating that into the healthcare system and in the provider network? The first example I'll use is a sort of a tablet-based Cbt app. We created this app with funding from the National Cancer Institute, and this was made for people who have less than 6 months survival expectation. And so today at Partners, it takes about 7 to 8 weeks to get a therapist, right, and to get an appointment and start your therapy. If you have a less than 6 month survival expectation, that's not really cool. So we wanted to augment the care that we can provide face-to-face with a tablet-based app. The way we designed this one, and this was designed in-house, was we replicated the therapist and patient interaction on a tablet thing. So it was pre-recorded videos of therapy sessions that a patient could watch. They were about 7 to 8 minutes minutes in length, so not very much. And patients were going to follow through these therapy sessions. As they're following through, between the therapy session, there would also be interactive components. So you could answer yes, no questions. You could think about doing some exercises. And then after finishing your videos, you would also get some homework, right? So you would think about what's the thought, what's the feeling, et cetera, and go through homework exercises between these sessions. And if you finish a session, it will unlock a second session, a third session, and so on and so forth. We also were able to capture PHQ-4 scores every week, and so that if someone, if a therapist saw that someone wasn't getting better or they were getting worse, that they could intervene and say, let's not do the tablet thing anymore. I really need to see you in person. The whole goal here was to free up therapists enough with patients who are sort of mild to moderate, so that if they could do some of the self-help on their own, that would free up time for patients that actually needed more help and more hand-holding. The second one, there's a lot of devices out there now that do a lot of really interesting things. I'm sure everyone has a Fitbit or has worn a Fitbit at some point or an Apple Watch. These were a couple of devices that came to our attention a few years ago as being really effective in stress management. The first one is Muse, which is basically a respiratory rate tracker. You clip it on your belt. Right, and it measures your respiratory rate, but it also watches your respiratory patterns. And they have built an algorithm that is able to tell if you're stressed. What's really also interesting about this one is it has biofeedback built into it, so that when it recognizes that you're getting stressed, it starts to buzz to bring your attention to the fact that you might be stressed. And it gives you a 10-second exercise on the app to sort of do deep breathing and sort of get you back in relaxation. The second device is sort of a mindfulness device. You wear this headband on your head, and you watch your mobile screen, and it sort of leads you into a relaxation response. And so it replicates the meditative effect. And what we wanted to know is, this is really interesting. We have, about 40 to 45% patients at Partners have self-reported some amount of stress within our primary care networks. So we wanted to figure out, do these devices actually have an impact on stress management? That's question number one. And then question number two, do people engage with it for a meaningful amount of time, and does engagement correlate with outcomes? So we designed a study. At baseline, everyone got a Spire, because that was sort of the outcome measure that we used, the respiratory rate. And then we divided them up into two groups. One group got just the Spire, and the other group got Spire and the Muse device. For the first 2 weeks, they would collect baseline data. We just wanted to establish a baseline for everyone's stress levels. Then, after that, for the first group, the Spire feedback, the biofeedback would get turned on, so that you could now get feedback on whether you're getting stressed or not. And for the second group, they would start using the Muse device. So that was the design of the study, total of 8 weeks, 2 weeks baseline, 6 weeks intervention. What we saw, really interestingly, is that for both groups, group number 1 and 2, the perceived stress went down statistically significantly. So in both groups, the devices actually did have an impact from enrollment to closeout on their perceived stress, as measured by the PSS. What's also really interesting is that we measured stress resilience. Stress resilience did not improve in the Spire device, but it did improve very significantly in the Muse arm. So people who went through sort of the 10-minute daily mindfulness exercise actually saw an improved stress resilience response. In terms of engagement, as is sort of expected in most of these digital trials, engagement drops off because initially you're really excited about it, and then over time you sort of get used to it. But not very significantly in the Spire group. And in the Muse group, actually, it stayed fairly constant. So this was sort of, on average, people used their device pretty much as expected throughout the trial. For this reason, we couldn't measure whether engagement correlated with outcomes. But what we did see was that once people got onto it, that people were engaging with these devices for a meaningful amount of time, enough to be able to lead to a statistically significant response. So as we're thinking about these sort of devices and the outcomes that we're getting from it, it's pretty clear that there is a role that digital tools can play in augmenting the effect of what providers can provide. And so the next question, obviously, is, well, can we meaningfully integrate this? Can we really make this part of the healthcare system in a way that actually makes sense? And so we've done a number of things at partners across the network to be able to provide some of these integrations so that you can actually do some of these things from the medical record. So the first thing that we've done is we've created an infrastructure using Validic, which is a device aggregating platform. This integration allows us to bring 400 different types of devices and their data into the medical record directly. And these 400 devices actually include applications on your mobile phones as well. So if you, for example, used a Fitbit, and if you are a partner's patient, you can go into Patient Gateway and start sharing your data with your provider, and your provider will start seeing it in the medical record. We have, again, a number of FDA-listed, FDA-approved devices that are available through Validic, as well as a number of consumer devices that are available through Validic. Today, I think the number has gone way above 400. We're at about 1,000 devices that are possibly integrated. And the way we have worked out on the workflow is, as a provider, you can go into Epic, you can go into the Connected Health tab, and you can invite a patient to share their data. You can also choose what you want them to share. So do you want them to share blood glucose, blood pressure? Do you want them to share their Fitbit data, their Muse data, their Spire data, whatever your case might be? Once you invite them, it sends them a message through the patient portal, Patient Gateway, and all they need to do is a 3-click process where they can enable the sharing of those data points for you. After that, you can start seeing those data points seamlessly in your medical record. So these data points are now available in the medical record. We basically use the vendor screen. So whatever design Fitbit, for example, has come up with, we basically take that screen and put it in the medical record for you to watch. So when you're in the patient's record, you will see a Connected Health tab at the top. Click on it, and you'll start seeing the data that the patient's sharing with you. And this is a small effort in thinking about how we can take some of these data elements, make it available in the medical record so that physicians can now start making decisions based on some of these data points. There's a whole lot of work to be done, and I think we'll talk about it in our discussion section today about how do we train our providers to actually use this data in meaningful ways, and how do we make these part of care protocols. We haven't gotten there yet, but this was our first step in at least saying, look, the data is available if you want it, and you can consume it in whatever way you feel like. All right, thank you.
Hi, good morning, everyone. I am going to try and get my slides up. That's not me, yeah, good.